Welcome to the Botetourt County Public Schools educational training for the prevention of COVID-19. We would like to welcome you back to school. Please know that you have been in our thoughts as we have planned and prepared for your return. We are all committed to the safety of our employees, our students, parents, and community members. Although the start of the year may look very different, we plan to safely maximize the time that we have together.
It is important to know the facts. First, diseases can make anyone sick regardless of their race or ethnicity. Fear and anxiety about COVID-19 can cause people to avoid or reject others even though they are not at risk for spreading the virus. For most people, the immediate risk of becoming seriously ill from the virus that causes COVID-19 is thought to be low. Some people may have an increased risk for more serious complications from COVID-19 and should take measures to protect themselves. Someone who has completed quarantine or has been released from isolation does not pose a risk of infection to other people. For up-to-date information, visit CDC's Coronavirus Disease Situation Summary page. There are simple things you can do to help keep yourself and others healthy. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. You can help stop COVID-19 by knowing the signs and symptoms. Fever, cough or other symptoms. Most people have mild illness and are able to recover at home. If you think you may have been exposed to COVID-19, contact your healthcare provider. Keep track of your symptoms. If you have an emergency warning sign, including trouble breathing, get emergency medical care immediately. People with COVID-19 have had a wide range of symptoms reported. The symptoms may range from mild to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms which are not attributed to another health condition may have COVID-19, fever or chills, cough, shortness of breath or difficulty breathing, fatigue or muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. This list does not include all possible symptoms. CDC will continue to update this list as they learn more about COVID-19. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list does not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs when people are in close contact with one another within about 6 feet. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. This is not thought to be the main way the virus spreads. COVID-19 may be spread by people who are pre-symptomatic or asymptomatic, not showing symptoms. Frequent hand washing can keep you healthy and prevent the spread of germs from one person to the next. Follow 5 steps to wash your hands the right way. Wet your hands with clean, running water, warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. Hand sanitizer, that contains at least 60% alcohol, can be used if soap and water are not available. Students should wash their hands or hand sanitize often, especially after blowing your nose, coughing, or sneezing. After using the restroom. Before eating or preparing food. Before or after touching your face. Before putting on or removing your masks after touching high-touch surfaces, doorknobs, handrails, computers, etc. Hand sanitizer, that contains at least 60% alcohol, can be used when soap and water are not available. How to use hand sanitizer: apply the gel product to the palm of one hand. Rub your hands together. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Wash your hands with soap and water as soon as it becomes available. Covering coughs and sneezes and keeping hands clean can help prevent the spread of serious respiratory illnesses like influenza and COVID-19. To help stop the spread of germs, cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in the trash. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Stop the spread of germs. Cover your cough or sneeze with a tissue, then throw the tissue in the trash can and wash your hands. Social distancing, also called physical distancing, means keeping space between yourself and other people. To practice social or physical distancing, stay at least 6 feet, about 2 arm lengths, from other people. A minimum of 10 feet will be maintained during all physical activities, and group size limitations must be followed as defined by the CDC, VDH, and VDOE under the phase guidelines in existence at the time of the activity. When physical distancing guidelines cannot be maintained, face coverings are required. Cloth face coverings will be made available to staff and students. Students will each receive one cloth face mask. Cloth face coverings are not surgical masks, respirators, or other medical personal protective equipment. Cloth face coverings are meant to protect other people in case the wearer is unknowingly infected but does not have symptoms. Employees and students K-12 are required to wear cloth face coverings when physical distancing guidelines cannot be met. Exemptions for face coverings include when individuals are exercising, using exercise equipment, if the individual is 2 years of age or younger, or if the individual has a documented medical condition that prevents him or her from wearing a mask. Important: all students must wear a mask during classroom exchanges, when entering and exiting the school, on the bus, and when 6 feet social distance cannot be met. Failure to comply with the BCPS health plan and/or not wearing a face covering during required circumstances could result in the student changing to 100% remote learning. Please speak with your administrator if you have additional questions. Wear your face covering correctly. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. Untie the strings behind your head or stretch the ear loops. Handle only by the ear loops or ties. Fold outside corners together. Be careful not to touch your eyes, nose, and mouth when removing the face covering. Place covering in the washing machine after each use. Wash your hands immediately after removing a face covering. All BCPS students are required to monitor and self-screen for symptoms of COVID-19 before reporting to school each day using the BCPS Student Daily Screening for COVID-19 log. If you answer yes to any of the questions, you must stay home and follow established procedures for reporting your absence. Temperature checks will be conducted at the school sites upon arrival. If you have questions, please contact your school administrator. Students will receive health screening logs. It is very important that you conduct this daily self-screen documentation at home prior to reporting to school each day. Staff and students should not come to school if they are sick with COVID-19 symptoms, test positive for COVID-19, or have been exposed to someone with confirmed or suspected COVID-19 symptoms. Students or staff who arrive at a school facility and report feeling ill or who are displaying COVID-19 symptoms will immediately be relocated to a designated isolation area. The student or staff member with signs of illness of COVID-19 symptoms will not be permitted to remain on school premises. Individuals who are sick will be required to go home or report to their healthcare provider, HCP. The symptomatic student will be required to put on a face covering or mask and sit in a separate area from all other staff and students until he or she can leave the premises. A designated staff member at the school will be contacted to provide care to the staff or student. The designated staff member will maintain social distancing while monitoring the symptomatic staff member or student until he or she can be safely transported home or to a healthcare facility. School personnel will implement cleaning and disinfection procedures of areas used by any sick individuals. Cleaning and disinfecting protocols established by the BCPS Director of Operations will be followed. Designated school personnel will inform the school administrator and Julie Baker, Director of Special Education and Human Resources, for further direction. Thank you for watching. We are committed to the safety of our students, employees, parents and community members. We appreciate your support this coming year as we work together to provide the best environment, educationally, emotionally, and physically for our school. In the months to come, Botetourt County Public Schools will continually monitor the pandemic circumstances and adjust school practices following the guidelines set forth by the CDC, VDH and state and local officials. We will work to keep you informed of any changes in practices, policies or procedures. If you have additional questions, please ask a teacher or administrator. Additional resources can be found on the CDC, DOLI, VDOE, and VDH websites.